All right. Now, so with all those good things out there in the hyperbaric chamber treatment, hyperbaric treatment, are there any dangers involved? Are there any side effects like with many, many other drugs? Yes, they're good for a particular thing, but at the same token, you have a warning label which is longer than the benefit label. What about hyperbaric?
Well, interestingly, the first couple days of treatment, some patients feel really fatigued and exhausted. And we believe it's probably because there are toxins that are being maybe mobilized from the system that are being eliminated, and that causes the fatigue. And that's maybe 15 to 20% of patients in my experience. And then by the third or fourth treatment, they're feeling fine. On the other hand, most patients actually feel better, I would say. So the majority feel better following even the first and second treatment as far as their energy levels. And we don't know exactly why this is, but I can postulate that it might be from just the reduction in inflammation in the body, because inflammation makes us feel fatigued and run down. I personally have a form of irritable bowel syndrome in which I can't eat certain foods, and I think it's due to inflammation. If I eat those foods, I find myself very fatigued and exhausted. And if I'm running a little fatigued and exhausted, and I go in the chamber, even for 1 or 2 sessions at an hour apiece, I find that I feel much, much better fairly immediately. Whereas some people get the fatigue, I think most people feel the same or better following treatment. As far as other dangers and risks, one has to be a little careful with someone with a ear infection, because a middle ear infection, there's pressure in the ears, and if you go in a hyperbaric chamber, it'll increase the pressure, which could potentially cause a ruptured eardrum. So we would want to wait until the ear infection is resolved for treating someone. Other side effects, really very, very other few limitations. Patients with congestive heart failure and emphysema have to be a little bit more cautious. With an emphysema, some patients have these little blebs in their lungs where the lung tissue is very thin, and you could potentially pop one of those and cause what's called a pneumothorax if someone has emphysema. But nevertheless, it is still used for emphysemic patients, but just with more caution and more observation. Some patients have a little bit of a trouble when they first get in the tank with their ears, even if their ears are fine, because of the pressure. As I say, it's like going down in a swimming pool a number of feet. And so in that case, we have to go more slowly with how rapidly we increase the pressure. And usually once the patient has a couple treatments and learns how to sort of equilibrate their ears, then they're fine and they can go at the regular levels.
Yes, I definitely actually had that happen myself, and they gave me chew gum, lots of chew gum. So I was chewing, lots of chewing.
Mm-hmm. Right.
That kind of like made it happening. And as you correctly said, after the second or third treatment, it was kind of not there. But the first time, actually, it was a little bit hurting. And then, the guy put it down a little bit, made it a little slower. I was actually in with my wife. She had nothing happening at all. And he put it a little slower and he gave me chew gums already before. He warned me of it. He says this could possibly happen. Start chewing and swallowing. And yeah, that it worked. And then the second time it was a lot less, but still there a little bit. Third time I don't remember anymore that something happened. Wonderful. So basically, that's about it. Here and there, a tiny bit of discomfort of some little things like that. Yes, pay attention for ear infections and things. Getting a little exhausted and tired. Which basically, actually, people anytime they take something which detoxifies them, they will actually get that. You understand?
Right.
I've seen that with many particular vitamins and things like that, where people take it and say, "Oh, I get a migraine." Yeah, because you detoxify. Keep taking it, and it will go away. You know what I mean?
Right, and then I get patients asking me about claustrophobia too, because many people are claustrophobic if they get in an enclosed environment like an MRI scanner. So we happen to have a 2-person chamber that's shaped like a tent. So patients get into it, and it's like a two-man tent, basically, and then the pressure pressurizes the tent. It has windows to look out. And so with this chamber, we've had absolutely no problems with claustrophobia. Some of the other chambers, which are the one-person chambers that patients lie down in, can be a little bit confining and tight, especially for larger patients. And I have heard of incidences of claustrophobia being a problem there. But as I say, with our two-person chamber, the tent-shaped chamber, we've had absolutely no problems at all.
All right. Well, wonderful. And you probably give them a Bowie knife with it, right, so that they can cut their way out of the tent if they want to, right? All right.